of the urinary system, we left off talking about dehydration, that when you are dehydrated, the kidneys and the filtering of the blood will go through this process to ensure that you do not pee out your water, that you put it back into the blood. So we use what's called ADH, or we produce, it's called antidiuretic hormone. You can think about it as like anti-urine flow, that you're going to concentrate the urine. When I say concentrate the urine, what that means is that there's less water and everything else is more thicker or concentrated. That's why often when you're dehydrated, the urine is like really dark in color. It's more yellow. ADH increases the permeability, meaning that the distal tubule and the collecting duct, those kind of like last parts of the nephron, tells them more water into the blood. Keep it in the body. Do not pee it out. This is regulated by, your kidneys will look at the blood volume. Is your plasma hydrated enough, or the blood hydrated enough? And meaning that the blood in the kidney, there are blood osmotic concentration receptors, which say, like, hey, is there enough blood? Is there enough water in the blood? So when you're dehydrated, what happens is your brain has receptors in the hypothalamus that notice that the water content of the blood, the osmotic concentration of the blood is very low. So what happens then is that the hypothalamus tells the pituitary gland to release ADH into the blood. The ADH travels in the blood to the kidneys, and it specifically tells the distal tubule, right here, of the nephrons, and the collecting duct to take water and put it back into the blood. Don't pee it out. So remember that you've got millions of these in the kidneys. So millions of these are checking. Thus, what happens is more water is in the body, not in the urine, and the urine becomes more concentrated or usually darker in color. So urine gets concentrated. This will continue until the person gets more water in their body, osmotic concentration starts to go up again, and then these, the ADH is not released anymore, and then these go back to their normal actions. Kidney diseases, kidney failure. 90,000 people die of kidney failure per year. It's also called end-stage renal disease, ESRD. If you've noticed, there's a lot more kidney centers going up, dialysis centers. Every strip mall seems like they have one these days. Rise in diabetes. Rise in high blood pressure. So we're talking heart disease and diabetes, which often exaggerate each other. What can happen is you get damage. When we're talking about either diabetes or blood pressure, you can damage blood vessels. Specifically, what happens here in the kidneys is in the glomerulus, the capillaries are damaged, and thus what we call that is kidney damage. Also, infection. Kidney infections can accelerate this. So, and then also overdoses or drug addicts. So treatment, hemodialysis. This is what we're talking about when everybody goes to those dialysis centers. We'll talk about different options too. There's a home option. And then the biggest one, kind of like most extreme, is kidney transplant. Check this out, 20,000 performed every year. So we're going to look at each of these. Hemodialysis. So almost 500,000 people going up too. What happens is you're hooked up to a machine that does the job of the kidneys. So the blood goes from your body into the machine, filters out waste products, and then puts the filtered blood back in, and you have to sit there for 4 to 6 hours and do it. Usually, if you're doing it at a center, it's 3 times a week, 4 to 6 hours, and then we'll talk about at home. You can do it at home, but essentially what you're talking about is that you're doing the same job of the kidneys, which is purifying the blood of waste products. Your kidneys can't do it. You could survive a lot of years on dialysis, but you gotta be dedicated. You have to make time. Okay, so there's what's called peritoneal dialysis. This is you can do at home. Permanent tube into the abdomen. You can hook yourself up at night and it'll do it all night. And then you could live a relatively normal life. You do have like, pants and things like that, clothes can irritate that area, so infection, people worry about that. They gotta check that port all the time, make sure it's clean. Make sure you don't have, you gotta have like the right kind of clothes, and so your fashion is a little bit different maybe for this. It can be easier than going to the dialysis center, but for some people it's not, because if you move a lot in your sleep, then you can't do it. Otherwise, you have to do it about 4 times during each day at home. So, kidney transplant. Kidneys are the MHCs, the major histocompatibility complexes, the little surface markers that say who you are, what organ this is. They still have to match closely, but kidneys are, I would say, like a little less picky about matching MHCs. But it's not like I could just give anybody a kidney. There still is a pretty good process. It often, if people will look for a donor, like they might reach out to their community, their family, and they might say, they might tell the mosque, they might put up flyers and say, if anybody was interested in seeing if they're a match, then this can be way shortened. So you can kind of do something on your own to accelerate that. Survival rates are really good. So even 10 years, the kidney does pretty well. Problem is that the things that caused you to have replacement of the kidney have to change. So a lot of behavioral changes for this to last. That's why it goes down significantly. People you're fixed, and then the kidney wears out because you go back to your normal behaviors.